So, in traditional medicine, we're taught to identify symptoms, put them together, and see if it meets the category for a diagnosis. And in fact, sometimes when patients have nonspecific symptoms and it doesn't meet all the criteria of the diagnosis, you'll look it up in the textbook and it will say if you have 6 of these symptoms, 5 of these lab values, some of this, some of that, it goes in the category that meets this diagnosis. So we're taught to recognize a problem, identify the lab values, the symptoms, the abnormalities, and come up with a treatment plan. It's all treatment and symptom based or abnormal lab based. We're treating the labs, we're treating the symptoms. Functional medicine recognizes that 90% of chronic medical problems we're not as good at in dealing with these in this country. And that's because we're not going after the root cause. What is behind the body expressing these symptoms? And you want to start thinking about it as the arthritis, the GI upset, the rashes, the brain fog, the headaches, the joint pain, even the inflammatory bowel disease. They're all due to something upstream that triggered this inflammatory response that's causing more toxins into the body, food antigens into the body, bacterial inflammatory products called lipopolysaccharides that in a domino effect cause this inflammation that patients individually express differently. And that's why the goal of functional medicine is to go back in time and try to identify where the key root cause is and start cleaning up these areas, which often goes back to the gut because that's 70% of our immune function. And by addressing the gut dysfunction and cleaning it up and removing the barriers, you just can't remove the triggers if the dysfunction is still there because new triggers are going to come in. So you have to remove the triggers that are hurting it and causing the inflammation, and then clean up the environment, and then change the lifestyle of the patient. And that's how everything gets under control. And that's where functional medicine is different from traditional medicine. It takes time, but the final benefits are there. Patients are too focused on the short-term relief of symptoms without realizing that ultimately you want to look at your long-term health, what we call your health destination, and really create a whole body feeling of feeling better. People accept being sick. I always talk about how I find people accept their diagnosis and start almost living it, where you really don't have to. I had severe asthma as a kid. That's why I became a doctor. I was hospitalized. I was on antibiotics. I was on antibiotics all the time. I missed so many things. And I could just accept my asthma, but I didn't. And I was able to get my asthma in remission. So I'm jogging, I'm doing all these things without asthma. And people can be that way. They don't have to accept their problem. And that's really what's behind functional medicine.